So the gastric bypass is performed in patients who have obesity and is a surgical way in which we can decrease the size of the stomach in order to be able to provide early satiety and therefore weight loss. And so here's a picture of the normal appearing stomach. Here you have the esophagus coming down into your stomach, and then you have your duodenum that eventually becomes your jejunum. And what happens in a gastric bypass is we create a gastric pouch, and the gastric pouch is then separated from the rest of the stomach, and there's a loop of jejunum that's ended up being brought up to the stomach to create a gastrojejunectomy, and then the more distal portion of the duodenum or jejunum is then anastomosed to the jejunum to be a jejunojejunectomy. And so therefore this creates a bypass by which you're able to move from a gastric pouch to the jejunum while also allowing biliary drainage through the duodenum and allowing that to enter into the jejunum. So let's take a look at a CT scan to be able to see how this looks on a CT. And so here's a CT of a patient who has had a gastric bypass. We can see that there's contrast within the distal esophagus here. The distal esophagus then comes into our excluded portion of the stomach, which is right here. You can see this is our gastric pouch. And then this is the excluded portion of the stomach. The excluded portion of the stomach then comes and goes into our duodenum, and we can see our duodenum right here. And then this crosses midline, goes over here, eventually becomes our jejunum, and we can see the jejunum right here. And then the jejunum keeps on going. This is continuation of the jejunum, and the jejunum here is anastomosed up here to the jejunal loop that eventually, if you follow this back, this is going to come back to our stomach, to our gastrojejunectomy. So let's look at our gastrojejunectomy and then trace that down. Here's our gastric pouch. It's got some contrast within it. And here we can see the jejunum. This is our gastrojejunectomy right here. And if we follow this right here, this is our jejunum coming from the stomach. It's now got contrast within it. And here it is coming along this way, moving down inferiorly, and then moving to the left upper quadrant. And so if we follow this, this is going to come back to this structure in the left upper quadrant, which is our jejunojejunectomy. And it's common for the jejunojejunectomy to be a little patulous and dilated. It's denervated, so it can look a little dilated. This shouldn't be mistaken for a small bowel obstruction. And so there are two limbs to our jejunum. One of them is our stomach to duodenum to the jejunum, which is going to be our afferent limb. And then there's the other limb, which is the gastrojejunectomy, that portion of it, which is going to be our efferent limb. And so this is the normal anatomical appearance of a gastric bypass on CT.